So this is the last video you're going to watch on joints. You have so far watched a video talking about the structural classification of joints, and hopefully you can rattle those off right off the top of your head. What are those structural classifications of joints? Hopefully you were thinking fibrous. And there's different kinds of fibrous joints, cartilaginous and different kinds of cartilaginous joints. And then you just finished synovial joints and watched Crash Course on synovial joints. And this is going to wrap up your notes and information on joints so that you can be prepared to take your joint test. And this classification is based on the function. And based on the function, there's 3 different types of joints, and this is based on the degree of movement. And so there are immovable joints, like, for example, the sutures of the skull, where they have those fibrous membranes in between them. They're what we call synarthrotic. Syn, thinking about without movement. And so that's our first classification based on function. Our second one is amphiarthrotic or amphiarthrosis. Those are our slightly movable joints. For example, the pubic symphysis. Oftentimes, yes, they do have cartilage, but we are not focusing on structure, we're focusing on function. So they're going to be slightly movable, these amphiarthrotic joints. And then the last one is the diarthrotic. These are typically our fully movable joints. Yes, they are typically synovial, so they typically have that cavity, but not always. So these are our diarthrotic joints, and so you do need to know synarthrotic, amphiarthrotic, diarthrotic as immovable, slightly movable, and very movable or fully movable. And next, we're going to go to joint pathologies and talk about some injuries and diseases that can occur with joints. And the first one that you should be aware of is arthritis, although you're not going to be aware of all the different types of arthritis because there's over 100 different kinds of arthritis. And generally what this does is break down the cartilage that protects the bone. That's that hyaline cartilage around the ends of the bones that are preventing the bones from rubbing against one another. And so this arthritis can be caused by injury, wear and tear. If you ever have a broken bone, can also be from an infection or an autoimmune disease. And a lot of arthritis they're finding now today is from autoimmune diseases. So what are the symptoms? Pain, stiffness, difficulty with movement, like almost feeling like you're trying to move a rusty hinge. Here's a couple of types of arthritis that you should be aware of. The first one, of course, is osteoarthritis. This is generally associated with people as they're getting older, people that are overweight, people that have had previous injuries. And so that's osteoarthritis. Rheumatoid arthritis, this is affects quite a few people around the world. This is an autoimmune disorder, and this generally starts with younger people, like around age 30. It can affect older people, but again, this is that's a really bad one for people that get rheumatoid arthritis. And then gout. Gout is actually a type of arthritis, and really it occurs because there's too much uric acid in the blood, and this forms crystals in the joint. And so people that have gout, my brother actually has gout, they say that if they can't even tolerate like a sheet on their big toe when their gout should be acting up. So a little home remedy for gout is to drink cherry juice. And you can go to the health food store and buy cherry juice for gout. Hopefully in class you got to see a bursa. So bursitis is just the inflammation of one of these bursa. It can be acute or chronic. It's often caused by rheumatoid arthritis or overuse or trauma, infection. Often this is occurring at the shoulder, knee, hip, and elbow. So those diarthrotic joints with synovial cavities. So the symptoms are typical symptoms that you're going to see with injury: tenderness, stiffness, swelling, achiness, The joint could be warm or red, and so treatment typically is going to be with anti-inflammatories, non-steroidal anti-inflammatories, something like Advil, physical therapy, things like that. So here's 2 injuries to joints that you need to be aware of: sprains and strains. All right, so a sprain is typically when like people sprain their ankle all the time, twist that ankle, and the ligaments stretch beyond what they're supposed to. And so that causes a sprain. A strain is really a muscle problem. And so that's when the muscle fibers tear because they've been overstretched. And the problem is that the symptoms are going to be very similar. Pretty much similar. Maybe more swelling with a sprain than a strain. And so how do we treat these things? Rice. And I'm sure if from your technical areas you know about rice, rest, ice, compression, and elevation are going to be the 4 big things that we can do with any injury to a joint. Another injury to a joint that again we could use rice for is tendinitis, and this is again inflammation and swelling of a tendon. This is typically from overuse. Can occur, at many of those synovial joints. And again, treatment of this, rest is a big one, and non-steroidal anti-inflammatories. All right, and now dislocation. And we've seen this happen before where somebody's bone sort of pops out of the place where it's supposed to be. This is known as luxation, and the joint gets misaligned. These can vary in their severity from really severe to, not very severe at all. Part of that depends if when those bones pop out of their synovial joint, if they go back in or not by themselves, or if they have to be realigned by somebody. Sorry, I thought I had one more thing in there. Subpartial dislocation is called subluxation, that can also occur. So I hope this helps you as you wrap up joints and prepare for your joint test.